All right. Well, thank you so much for joining us, Amanda. We really appreciate having you on, and we appreciate you taking time out of what I know is a very, very busy schedule.
Yeah, yeah, for sure. But I am so happy to be here.
Absolutely. Let's jump right into our questions for you. So, Amanda, your job is not an easy one. And I almost always find that people in behavioral health have a specific reason for being in behavioral health. So, would you mind sharing your story and how you got into this field?
Yeah, absolutely. I got into this field because I believe that healing should never happen in isolation. Growing up, I saw the ripple effect of untreated trauma and addiction in families and communities. I wanted to create spaces where people felt safe, understood, supported, and equipped to break the cycles. For me, behavioral health isn't just a profession, it's a calling to restore dignity and possibility to people who often feel forgotten.
That's awesome. That the tie to your personal vision, your personal passion is so important. I think burnout is always something that happens, and it happens more if you're not tied to that passion.
Absolutely.
So you've built a career in blending clinical expertise with executive leadership. How do you balance operational demands with staying really connected to the client experience?
I balance it all by staying close to the front lines. So even when I was an executive in a behavioral health company, I made it a point to walk the facilities, sit with clients, and listen to what clients were truly experiencing. On the counseling side and the private practice side, I continue to see clients. I supervise interns and clinicians, which for me grounds me and gives me the reality of the work that we're doing. That connection keeps my leadership decisions people focused instead of just number focused.
That's awesome. So you've also made kind of a priority out of cultural responsiveness in behavioral health. Can you share a moment or a story when that commitment actually changed a patient's outcomes?
Yeah, so one comes to mind. I remember a client whose treatment plan initially didn't really reflect her cultural background or her family values. She was titled as what oftentimes we see in treatment resistant. And then once we started to really kind of ask the right questions about her faith, about her family, her sense of identity, her entire engagement shifted to trust the process because she felt seen as a whole person, not just as a diagnosis. That moment really, really enforced for me that cultural responsiveness isn't optional and it's necessary to have effective care.
Absolutely, absolutely. Because almost everyone is in a different part of our culture or in their own little micro cultures, right? And if you're not being responsive, then you're not talking to them like they're in the same world as you. Yeah. So leadership burnout is a real thing in this field. What's your kind of personal playbook for protecting energy while still leading at some of the highest levels?
So it's simple. It's three parts, and that's boundaries, grounding, and creativity. So boundaries for me means protecting myself and my time with my family and not over functioning for anybody else. So grounding is staying connected to the practices that I enjoy practicing, meditation, journaling, and simply being outdoors with my family. And that regulates my nervous system. Creativity is huge for me. Anything creative, coloring, writing, designing new projects keeps me energized. So protecting my energy isn't about doing less, really. It's about intentionally choosing what matters the most to me.
That's awesome. I think I can't remember who said it, but what you just now said brings to mind this thought where energy is not about protecting where you spend it; it's about protecting where you build it,
Right.
which I think makes a lot of sense. And so you're in a pretty competitive space. How does your team go about gaining new clients, new partners? What's working well for you right now?
Authenticity. So people in this field want to feel a sense of trust and safety from the first interaction. So with Zenful Collective and Zenful Counseling, referrals are still word of mouth, and it's still the strongest tool that we operate from. Clients and leaders who feel seen and supported naturally want to share their experience. I also lean on digital storytelling from time to time through my journals, toolkits, and online content because it gives a potential client a little glimpse of how I think and lead before they ever book a session with me or a consulting.
That's awesome. That's awesome. That's really, really important. I think people often forget that clients are just real people too, and they want to know what they're getting into before they just start a whole new partnership with a new clinician. Yeah. What have you found is one of the hardest parts of growing your team or your organization?
The hardest part has been finding alignment. And what I mean by that is making sure that the people I bring in share the same values of inclusivity, compassion, and accountability. So it's more than just me looking to see if they have the clinical skills, I want to make sure that they have the same values that the organization has. As you know, behavioral health is a demanding workspace. And if someone doesn't align with those values, it impacts both staff morale and client care. So growth for me isn't about the numbers, it's more about integrity.
That's awesome. That's awesome. And what is one marketing tactic or strategy that you're currently considering or watching really careful in your community?
I would have to say community based marketing. So, building trust and visibility through authentic engagement, kind of like what I shared earlier, rather than traditional ads. That might mean partnering with a wellness space, offering free resources online, or creating content that helps people feel connected before they ever purchase a service. So, in this space, relationships will always outperform flashy campaigns.
Absolutely, absolutely. Yeah, and the only marketing that works generally in this space is marketing that builds on that reputation, that builds on those on that real trust.
Mhm,
Yeah,
absolutely.
that's awesome. That's awesome. Well, thank you so much for joining us, Amanda. We appreciate you taking time. We appreciate your insights, and we appreciate the impact you're making in your community. So thank you so much.
Thank you so much for having me.
Absolutely.